Well, good afternoon, everyone. This is I guess this is about the third time we've gotten together. Um, I am I'm looking forward to this presentation because we're actually got some guest speakers coming and join us, and so I'm excited about hearing from the industry and seeing how uh, they have been putting some things in place. But before we got started, I just wanted to kind of go through this presentation. Got a few slides here, and today's November 16th, and this is our COVID-19 response and guidance from Brunswick County Food Safety Partner Meeting. Um, just wanted to, it's grateful to be a part of this team, and important that we still, put some measures in place to protect your health and the safety of others. This is the team that's, most of you have seen these slides, and for the new people that came, I'll welcome you. And the format is normally set up whereas you can ask a question during the presentation. Most people will be muted, except the speakers. But if you wanted to ask a question, you can write that question in the chat box, and Megan will be looking at those questions and be trying to incorporate them into the presentations so we can make sure we get all those questions answered. But we're just really excited about having this opportunity, and we encourage you to ask any question that you may have. And if we can't answer the question today, we will try to get you an answer later on. The idea is to share this presentation with you guys in an email and some additional information about this presentation in the future, so you can have them, have it available to you at any time. So just to go overview, we're going to just do a little quick update for environmental health. And then Brunswick, the Cooperative Extension is going to go over a couple of items. Then we're going to have the social media. Megan's going to talk a little bit about promoting Count on Me, North Carolina, for Brunswick County. And then Allison's going to talk a little bit about the North Carolina Department of Health and Human Services initiatives of getting behind the mask. Bobby Johnson is going to, our program specialist here for environmental health, will answer some questions that we received throughout the time that we've been meeting, and sent some emails out, and just wanted to give you some response to those questions that have came in. And then, like I was saying, some industry leaders are going to speak to us. So things I wanted to just update you on is a couple items. It's dealing with the Executive Order 176, Phase 3. It extends Phase 3. And the one thing that it did do was lowering of the indoor mass gathering limit to 10 people, down from 25. And another thing I wanted to also share with you guys is full service restaurants are now available to tap into this assistance through the mortgage, utility, and rent relief program. That is being administrated by the North Carolina Department of Commerce. And what that really does is it allows you to request through an application, for the past 4 months, and it can help you assist with rent or mortgage, or there is a cap of up to $20,000, and it's per location, up to 2 different locations. And so I'll send out some more information regarding that. This unique opportunity to help you out if you need some assistance with whether you're at through this pandemic. But North Carolina Commerce.com is where you can find this information. And like I said, I'll share that in an email shortly to come. But I did want to share that with you guys, and just to kind of give you an update of where North Carolina is at, especially in the rural development. Our cases have nearly twice doubled in our rural communities just in the month of September. And so that's where we kind of reside at. And so it's still a growing concern, and we just need to continue to put in the safety measurements that we have been putting in place, and trying to reduce that exposure as much as possible. But to help with that process, there is a new product that came out, and this product is really they're calling it a smart product, and so it's smart power from Ecolab, and it does require specific test strips whenever you use this chemical, but it's designed to be a disinfectant and a sanitizer. So it's trying to do a smart clean, and it's one-time application. So I've sent out an email with some of that information out there. If you have questions about this product, feel free to ask us, and we will try to get you some answers regarding that. But the biggest thing is this product is approved to be a disinfectant. Your contact time for this chemical is about a minute for it to be able to be used as a sanitizer and a disinfectant. So hopefully this will help you out with even more different. You don't have to use this product. It is EPA approved. You can go to the website that we talked about in the past, and type in the registered number from the EPA, and it will come up. But I provided a lot of that information in our previous email. So if you got questions about it, Doug, feel free to ask. So we're going to go to our next slide. And that brings us to Cheryl.
Afternoon, everyone. Just to update you real quickly, I know some people have been on the list for a while. They're wanting to get their food safety manager training updated, and Cooperative Extension here in Brunswick County for many years has been doing some food safety manager training. The last several years, it's been called Safe Plates. We did have some scheduled. Actually, I think we had classes scheduled for today, and obviously they're not happening. But I am pleased to announce that we're going to have some trainings virtually come January 1st of the year. They'll be online where people can watch the videos at their own time. So if you or your staff want to watch them in the middle of the night, you can watch the videos in the middle of the night. But we will have office hours, and we will have group meetings also by Zoom, so people can ask questions and perhaps get some guest speakers online locally, so we can get to know each other and answer questions and any specifics that you have. So it's not just a matter of watching videos and then taking the test. And people will be making appointments to take the test in a safe manner. So as soon as I know details, I will get that out to folks. I don't know what the cost of it is going to be. In the past, it's been about $150, which included all the materials, all the training, and the testing. But if you want to get on the mailing list or the email list, so as soon as I know when we'll be offering it, there's going to be like a 3-week window that will say, okay, everything's live, you can start doing it now. And then we'll do these office hours locally, and then make those appointments to let people take the test with a proctor. Okay, next slide, Danny. Someone said, is Safe Plates in lieu of Serve Safe? Safe Plates, Danny, you worded it carefully last time. Safe Plates is very, very similar to Serve Safe. The concept and what the Health Department, Environmental Health is recommending is an ANSI approved test, American National Standard Institute, and we are offering that test that is very comparable to the test that the National Restaurant Association is offering with ServSafe. The material that we're teaching and the material that ServSafe teaches is all out of the food code, the Food and Drug Administration food code. hello, we have a new message here. Okay. So please email me if you have questions, and I'll get back to you and try to answer those questions regarding a food safety manager training coming up. And just again, reminder to folks and to thank those that have been taking the Count on Me program. I've been seeing the videos if you're watching football games on television. I actually listen to a radio station on my computer in the morning, and it's been popping in there with the Count on Me logo, and people have been singing the jingle. But Count on Me is a program that was developed here in North Carolina by our colleagues at North Carolina State University, North Carolina Extension, the Restaurant and Lodging Association, North Carolina Travel folks, and the North Carolina Department of Health and Human Services. It has been updated. They're constantly going in there and changing things when executive orders changes and new information about the COVID situation does come available. They're putting new information in there. If you've signed up and taken Count on Me in the past, you can just go back in and get an update. But the goal there is to protect both you, your employees, and your guests, and trying to keep everyone safe. Next slide, please. If you haven't done Count on Me NC, it's a series of modules. You can go to countonme.org. It is completely free of charge. Again, online, you can do it in the middle of the night if you have the time to do it then. Do the business training. They're business training for restaurants, front of the house, back of the house, managers. There's also training for your guests, and we're trying to really encourage customers to take part in this and let know that they're part of this situation too. And then there's also a training for retail stores, museums, boutiques, other kinds of situations, not just restaurants. You enroll through a program called Eventbrite. This is really only so they can keep track of who's doing it by email. You enroll and then you get the information right away, so you can just start doing it right away. The thing that you need to remember is request a certificate when you finish, and then please put that certificate up so your customers, your employees, everyone knows that you've taken the training, and then register your business at the website. It doesn't automatically happen just because you put an email and a city in there. You have to go back in and register. But we're also encouraging customers to say, okay, where am I going to eat tonight? Let's go to the Count on Me website and see who's taken the training and where might I feel safe going. And right now we have about 100 facilities and people here in Brunswick County that they're on the website, and you can see them on the map. So that's great. But again, questions about that, give me a call, drop me an email. Who's next? Megan.
I think that, yeah, hi, this is Megan Cassatt.
Yeah.
Thanks, Cheryl. So just to tie in with what Cheryl just communicated with you all, I'm the Public Information Officer for the county, and we have been actively trying to encourage everyone not only to take the training, but also to let us know when they complete it, let us know when you complete it, so that we can showcase what you've been doing, and we can further communicate and encourage residents and other businesses in our county to complete Count on Me NC and learn more about it. We've had a lot of people who have snapped photos of them when they're masked with their certificates and sent them our way so that we can showcase them on our website and in our social media. And so we highly encourage, it doesn't matter when if you did it 3 months ago and you haven't sent in a certificate photo yet, that's totally fine. Please send it in. We do look and make sure that you're all registered on the website. So again, following those steps that Cheryl mentioned is really important, but we definitely want to showcase what you all have been doing. We do have our own page on our website, brunswickcountync.gov/countonmenc. So we do post pictures there. And then we also have links to all those trainings that Cheryl had mentioned. We also have a new link. This is we added recently, but there's actually a media toolkit that includes videos about Count on Me NC, social media graphics, things of that nature that you can actually download and use on your channels so that you can promote it out and show everyone that you are participating in Count on Me NC. And we highly encourage you to do that to help us promote the program. Of course, we've been sharing things on our Facebook, on our Twitter, and on our Nextdoor and LinkedIn pages. So if you're not following Brunswick County, we highly encourage you to follow us there, and you can just share along what we've been posting to help us get out the message. Every little bit helps, but you can find links to all those resources and more at brunswickcountync.gov/countonmenc and how to send us your photos of your certificates if you have not already. Thank you so much, and I think we're going to pass it along to Allison next.
Thank you, Megan. My name is Allison Campbell. I'm a health educator here at the health department, and I just wanted to share the new Get Behind the Mask initiative with you guys. It's a new initiative through the North Carolina Department of Health and Human Services, and the basis behind this initiative is the decision to wear a mask is not about who you know or how well you know them. So basically, it's encouraging all North Carolinians to get behind the mask or wear a mask, regardless of where you're going to be going or who you're going to be around. It's also encouraging everyone to remember the 3 W's, which the first one is wear a cloth face covering, wait 6 feet apart or avoid close contact with other people, and wash your hands often or use hand sanitizer. Resources and materials for this initiative are available at covid19.ncdhhs.gov, and there are flyers that you can print and post in your business if you would like to post them, and there's also graphics that you can share on social media and websites as well. Okay, so I think I will throw it back to Danny now to go over the last 2 slides.
If you don't mind, Allison, could you discuss a little bit about some of the phone calls that we have been receiving and you know, just kind of where that's landing at?
Oh, yes. Thank you for reminding me. So we have a call center and an email line here at the health department for COVID-19 questions. We have received a lot of phone calls and emails from the public just reporting businesses or other establishments. Just people are noticing that maybe people aren't wearing masks like they should or social distancing like they should. So we do receive those emails and phone calls. We do forward those along to environmental health for awareness so they can reach out and provide education to businesses and restaurants. So just wanted to let everybody know to be mindful. People are, you know, reporting complaints and things to the health department, and we do have environmental health follow up with those things.
Thank you, Allison.
You're welcome.
So I would like to turn it over to Bobby Johnson right now, if we can, and just Bobby, if you don't mind taking a few minutes to answer some of the questions that we have received.
Sure. And my name is Bobby Johnson. I'm the Environmental Health Program Specialist for Food and Lodging. And just wanted to go over a few questions that were submitted when we sent the email out asking for questions. So we did get about 4. They're specific to lodging facilities and bed and breakfast homes, but I think it's general information that can be shared with the group that'll be helpful. The first question was, are there any special rules or recommendations for B&B owners to follow for bed and breakfast homes? And we're going to use the same guidance that we've been giving to every establishment, following the 3 W's, practicing social distancing, wearing a cloth face covering, and doing symptom monitoring for guests. It's not something you're probably going to ask them the questions while you're there, but you could at least post the signage so they're aware of what questions they need to be going over with themselves to make sure they're not showing any signs or symptoms of COVID. You can use things like contactless payment options by phone or online. Protect yourself and your guest. Most importantly, to use an approved disinfectant that's listed on the EPA.gov's website under List N for disinfectants that will kill SARS-CoV-2 virus. You want to clean and disinfect in your hotel settings or lodging facilities high points of touch areas that are used by guests, such as tables, doorknobs, light switches, countertops, phones, things like that, that people are in close contact with and touching frequently. You also want to pay careful attention to use the instructions for that disinfectant and the approved contact time so that the disinfectant stays on the surface the amount of time it's supposed to kill the virus. Another point of interest is when you're handling laundry, you want to be very careful with that. Have your staff use PPE protection such as gloves and face coverings. You don't want to shake out the dirty laundry. You don't want to create any kind of aerosolized environment where the virus could be spreading. You want to clean and disinfect your clothes hampers using that approved disinfectant. Use extra ventilation, such as opening windows when you're cleaning rooms. If you have a vacuum cleaner, you want to use one that's equipped with a high efficiency particulate air filter, such as a HEPA filter if available. You want to discontinue the use of fans in common areas, something that could spread aerosolized particles through the common area. We did have a question about going from a full breakfast to a bag-and-go option. A lot of our chain facilities are still using the bag-and-go option, but if you want to switch to a full breakfast, some things that we recommend is maybe, because a lot of the bed and breakfast will have a common dining area or dining table for their guests, we recommend that you stagger guest times for meals. So it gives you time between guests to clean and disinfect properly. Another thing you can do is reduce the use of condiments on the table that are shared from guest to guest, maybe putting those in separate bowls or disposable items. Instruct your guests to use hand washing using a bathroom that has single-use towels and maybe some hand sanitizer at the beginning of a place setting. And have the guests wear face coverings when they're not in their room. Some other questions we had are about ozone cleaners. I wasn't really sure what the participant was asking, so maybe we could send that email again. I was able to find some information on ozone generators. Those are not recommended in occupied spaces. We want to just stick with a disinfectant that's listed on the EPA.gov's website. And have one last question about concerns about HVAC systems through shared rooms. You just want to check that your HVAC filter is correctly in place and consider upgrading to a filter to the highest rated that can be used with your system. So for guidance on that, you would want to contact or use your HVAC manual or your professional that services your system. Air purifiers can also be used to help reduce airborne contaminants, including viruses in our home or a confined space. And again, as we mentioned, care should be taken with portable ventilation such as fans, just because it can spread the aerosolized particulates through the environment. That's the questions we had. Danny, we'll turn it back over to you to see if there are additional questions.
So we just wanted to show this last slide here. It's giving you some of those resources that Bobby has kind of been talking about, and other folks, the Count on Me, the Restaurant's Guide, the Disinfectant website, and then the incentive for Get Behind the Mask. So this will be a part of the presentation to send out to everyone, so y'all have that available to you. And so that kind of wraps up our little section of this. So now I guess we'll turn it over to some of our industry leaders. And I was wondering if Caesar was available to discuss some of your experience that you had. Ben. Caesar, you there? Uh-oh. Well, how about is Jim Miller there?
Yeah, I'm here.
Okay, Jim. I appreciate you sharing your opportunity, with your operation and stuff, what you got going on. And I just hope this brings some insight to some other folks and trigger some, conversation. But if
Yeah.
you wouldn't mind, introduce yourself and let us know what you got going on.
My name's Jimmy Miller. I'm the general manager of the Chili's in Charlotte here. And as far as what we have going on, it's just been an interesting couple of months to say the least. But we've done a pretty good job of, setting up good standards within the restaurant, good guidelines that we follow. Chili's as a company has done well, setting us up for success. As far as the front of the house goes, we have the 50% seating capacity, and we just have the tables marked off, every other table, and measured in between, so there's 6 feet distance. As far as some other things we have set up for the front, we have sanitizing stations set up for the guests, one right at the host stand, one by the restrooms. We keep the benches taped off out front so guests don't sit and gather out there while they're waiting to be seated. Some other things we do as far as safety for the guests is we get phone numbers from them when we do go on a wait, and then ask them to wait in their car, and then send them a message when their table's ready, so they don't have to gather in the lobby. So we just try to keep everybody out of the restaurant as much as possible. Same with our to-go experience. We're still currently doing curbside only as far as to-go. We don't let anyone in the restaurant. We just have them stay in their car. We do the payments outside. If there's no one out there, usually we keep one of our team members out in the parking lot to greet cars as they pull up. But if other restaurants, can't do that, we just have a sign up that says if no one's out there to call, and somebody will be out. That again just prevents people from, piling up out in the lobby there. Chili's has implemented a digital menu for guests too, where they can pull it up on their cell phone and just scan it on the menu. And then, so we don't have to, hand out menus or reuse menus. So that's kind of cool. And then, as Bobby said, we have everything off of the table. So we portion salt, pepper, condiments, things like that. But that's what we do as far as, safety for the guests. As far as our team members go in the heart of the house or the kitchen, even the front of the house, before they clock in, they swipe their clocking card. It comes up a question if they have a temperature. It asks them all the questions about COVID as far as symptoms go, if they're feeling any, and it won't let them clock in if they are, symptomatic at all. They have to come get one of us, and then we go through that and decide how to go from there. And then we take the temperatures when they come into work, just make sure nobody's over 100. Masks 100% for everybody in the restaurant all the time. We have timers set for disinfecting and washing hands that go off. And it just, when the timer goes off, the hostess or whoever stops what they're doing and disinfects, the high use areas, the doorknobs, bathroom doors, anything like that. And then same in the kitchen, they do the same, and everybody stops what they're doing, washes their hands. So we have that in place. And then as far as the kitchen goes too, we have team members all scheduled in zones. So they're in, before they all used to work together up and down the cook's line. Now we just keep them in their specific section. So if the fry guy stays on fry, the salad person stays on salad. And that way they're not, crossing paths or trying to keep as much distance as possible throughout the shift. So that's about it as far as what we have going on here.
Great. Thanks, Jim. That sounds good. And, we really appreciate all your efforts that you're putting into this and taking it serious. It seems like I really like the ideas of the little bell timers going off and just kind of giving the folks a reminder. That's pretty neat. Anyway, we will move to Caesar now. See if we got Caesar on. San Felipe?
Yes, sir.
Ah, there you go. Okay. How are you?
Very good. Thank you. Hi,
Can you-
everybody.
Can you just go ahead and introduce yourself and go ahead and kind of share what's going on with your operation?
Yes, sir. I work for San Felipe. I'm the manager in Southport. We're working together to fight the COVID-19. We following the steps to keep people 6 feet apart, to sanitize and disinfect everything. I talked to Cisco company about disinfectant we use, and we make sure it's working for the coronavirus. And we use peroxide disinfectant and sanitizing. The labels, it says specific, it kills the human coronavirus known as a SARS. It also kills the what is influenza H1N1. And we try to we keep our employees 100% with face masks. We disinfect and clean all day long. And we encourage all the customers also to use wear face masks, and we provide them with one if they don't have one.
Okay.
Yeah, so pretty much I think we all working together, and we follow the guys as health department. All they bring available all the information, and we use everything we have on hand.
Well, that sounds good, Caesar. One thing that I noticed with your establishment, y'all use y'all are going to paper menus in the one down in Southport at least. So there's kind of a disposable use of the menu, so you won't have to worry about cleaning and disinfecting those between each exchange. Is that something y'all been putting in place?
Yes, we do. We use lunch and dinner menus, and we also sanitize the pens because people sign or whatever.
Right.
The disinfectant we're using, it says it has 5 minutes time working on killing viruses and bacteria. So we sanitize them, we let it sit for over 5 minutes, and when it's ready to use it again for the customers too.
Well, once again, we really do appreciate what both of y'all are doing. As far as that goes, there's a lot of our restaurants that are really doing an awesome job out there, and I just can't commend y'all enough on what y'all are doing on trying to just reduce this exposure of the virus. And I know it's very challenging. There's a lot of recourse you may be getting from wearing that mask and trying to put these extra steps in as far as disinfecting and cleaning as frequently as you're having to do. But it, I just want to tell you thank you for what y'all are doing. It's a tremendous effort that y'all are putting into place, and I hope our customer, our Brunswick County citizens are able to recognize the efforts that y'all are putting into it, because I have. But at this time, I just wanted to open it up to anybody who may have any questions. I don't know if Megan might have seen any questions coming through the chat line, but anyone that's got something, I think we'll try to answer them now. Anyone got any questions for either of our guest speakers? Megan, do we see any any questions in the chat room?
No, Suzanne had made a comment that that she had liked that Bobby had covered bed and breakfast earlier, and that they have separate seating areas for breakfast, so guests don't feel rushed with their meal. I don't know if anyone else even has other recommendations or things that they're doing that they found helpful that they want to place in the chat. But any questions, please feel free to chime in.
Well, I guess we can wrap it up right now. Is it any of the team members have anything they would like to share? So, I hope this is a format that we can continue on, and we just really would like to open up some dialogue between our team here, not just with environmental health, but cooperative extension. Megan with our information officer, and Rachel is joining us. Sometimes on these calls. Rachel Baldwin with she's the lead for the COVID-19 response for health services, and she was actually a presenter last meeting, and we were just grateful to have her being a part of that conversation. So, if there's something that comes up that y'all would like for us to try to help you out with, I mean, we're here to to just try to help out and get through this time. I know it can be difficult for a lot of operations and businesses, and but I will say I'm very proud of what people in Brunswick County are doing. Y'all are really taking the incentive, especially the different industries and businesses that I have visited and been a part of. So just keep up the good work, and we will send out some information, on this presentation in the near future, and hopefully we can schedule another one. But we really encourage y'all to submit your questions, and we'll try to format our meeting based on those questions. If we can get something in line in that order.
So we did get one quick question, Danny, for the team. And so they just were wondering, is it best right now, it's recommended to continue using paper menus for the foreseeable future, or what are thoughts on that concerning use of paper menus versus other?
That is the recommended guidance, is to use single-use menus. There's no question that's the recommended guidance at this point in time, and we do see that moving forward, in the future, that stays that guidance. Bobby, you want to weigh anything?
Sure, that is the recommended guidance that we have right now. I have seen people actually laminate their menus. They would have to be disinfected since they're a high-touch area. So it's just taken into consideration staff and the timing you would have to meet that contact time with your disinfectant to kill the virus on a menu. That's why a lot of people have opted, or there's the recommendation in place to use the single-use menu.
All right, guys. No other questions. Appreciate it, and we will talk to you soon.